All right, good morning, everyone. Thank you for joining us. We are waiting for some other folks to continue to join us, but we're going to get started just because we have a lot to share with you within this hour-long webinar. I'm Lynanne Gutierrez, and I'm the Assistant Director and Legal Counsel at Groundwork, Ohio. Groundwork, Ohio is the state early childhood advocacy organization whose mission is to champion high-quality early learning and healthy development strategies from the prenatal period to age 5. To lay a strong foundation for Ohio kids, families, and communities. And today we're really excited to release Building the Way to a Healthier Future report with you. A few housekeeping reminders. You are on mute. I cannot see you, but I hope you can see me and the slide presentation in front of you. If you have questions, you can put those in the chat box function on the right side of your screen. Please include, if you have a question during the presentation, your email. We won't be able to respond directly to questions on the report or from the panelist discussion. So we'd love to respond to you directly with that after the webinar. So please provide your question and your email. Feel free to give us a shout out, and we're glad that you're here. Please also feel free to share on social media today if you want to show your support during or after the event, or if you're inspired by something you hear today and want to share with your networks. At Groundwork Ohio and at Ready Set Soar OH are our Twitter and Facebook and Instagram handles for social media. There will be a recording of this webinar available on readysetsoaroh.org, along with the report being available again at readysetsoaroh.org, and we'll put the direct link to the report in the chat box now so you can access it. I'm now going to turn it over to Wyonette Cheairs. She is the manager of the Lead Safe Cleveland Coalition, to provide an introduction of why and how we came to present this report to you here today. Thank you.
Great, thank you, Lynanne. Good morning, my name is Wyonette Cheairs, and I'm the manager of the Lead Safe Cleveland Coalition and a program officer at Enterprise Community Partners. I'm honored to be here today sharing an introduction to this groundbreaking report and to lay the groundwork for how we got here today. So as I mentioned, I work for Enterprise Community Partners, which is a national affordable housing nonprofit that has 11 market offices across the country. And I work out of our Ohio market office in Cleveland, Ohio. Enterprise Ohio serves as the manager of the coalition, and I, along with our Mark McDermott, our VP and market leader, Emily Lungard, state and local policy director, and Ala Jali, serve as the lead team at Enterprise. So lead poisoning is a public health crisis. And in Cleveland, lead poisoning is a legacy issue like many other older cities in Ohio, and our future depends on children having healthy, safe places to live and learn. Lead poisoning affects a child's developing body and robs them of their potential, and even small amounts of lead in children's body can cause permanent learning and behavioral problems, often with no physical symptoms. And we know that there's no safe level of lead in the blood, and yet a study conducted by Case Western Reserve University found that among all children entering Cleveland Municipal School District between 2014 and 2016, 25% of them had elevated blood lead levels at or above 5 micrograms per deciliter at some point before kindergarten. These numbers are staggering. In recent years in Cleveland, lead has been at the forefront of media, grassroots policy agendas, and a growing concern for the philanthropic community. There was political will and momentum and resources to bear to support a coordinated approach. And in January of 2019, the Lead Safe Cleveland Coalition was formed, and it's a public-private partnership that's committed to addressing lead poisoning through a preventive, comprehensive, and long-term approach. We believe that if we create lead safe spaces, we can prevent lead poisoning from ever happening. So our approach is really on primary prevention, eliminating lead hazards in the interior and exterior before a child is poisoned through lead. So the coalition is built actually on the previous work of grassroots, clinical, and public lead work that's been taking place in Cleveland for decades, and built on best practices from places like Rochester, New York, which reduced lead poisoning prevention rates by almost 85% in a 10-year period. What's new about the Lead Safe Cleveland Coalition is the city buy-in. Cleveland City Council, council staff members, as well as members of the mayor's administration are actively involved in our coalition and in the committees. And today, the coalition has over 425 members, 7 working committees with leadership from across local, state government, private sector, philanthropy, residents, landlords, teachers, caregivers, housing and community development organizations, researchers, and so much more. Our work, the coalition's work, like this report, is supported by the Funders Concerned About Lead Poisoning, which is an informal group of major philanthropic organizations in Cleveland, including the Mount Sinai Healthcare Foundation, Sisters of Charity, Cleveland Foundation, Gun Foundation, Bruni, United Way of Greater Cleveland, St. Luke's, and Third Federal Foundation. As some of you may know, in July of 2019, Cleveland City Council passed historic legislation that creates a proactive lead-safe standard for Cleveland rental units built before 1978, a lead-safe certification that starts March 1, 2021. And during that time, the question was raised how we can create similar protections in childcare settings, and that brings us to this report. So the coalition is committed to creating lead-safe spaces, and that also includes childcare settings. In August of 2019, we started the lead-safe childcare settings subcommittee that was chaired by Enterprise and Starting Point. And the coalition engaged Groundwork because we're committed to the same approach we advocated last year: preventive, feasible, and enforceable approaches. We use the term like system change. We mean it when we use that term. With respect to a child care, we know that it's its own system governed by the state and has different regulations and challenges and funding streams. And so we knew we needed to partner with the experts in this space, and we reached out to BILLIE OSBORNE-FEARS and Starting Point, who answered the call to lead this work and bring us up to this point. And so as we mourn the loss of BILLIE OSBORNE-FEARS, we know that the loss of her leadership will have an impact on our work, and we're regrouping as a coalition, but one of our first pieces of work is to expand our partnerships. And we know that we need all the partners and providers, families, local, county, and state partners, and others that are represented here today to help us move things forward. Lead poisoning is an equity issue, and childcare should be a part of any primary prevention plan. And now, more than ever, during this pandemic, we're reminded of the importance of a safe place to shelter. And we know that other than home, children are spending a significant amount of time in childcare settings. So we appreciate BILLIE's leadership and the vision for carrying us this far. We would like to thank the Lead Safe Childcare Settings Subcommittee and Groundwork Ohio for this incredible report. At this point, I am going to read a tribute to BILLIE. So as you may know, this report is dedicated to BILLIE OSBORNE-FEARS, because without her leadership, we would not be here today. And so just a snippet of the tribute that's in the report reads: BILLIE OSBORNE-FEARS is a trailblazer who dedicated almost 40 years of her life to child advocacy and public service. BILLIE began her career as an early childhood leader, and over years served in many roles before becoming the founding director of Starting Point, the first resource and referral agency in Northeast Ohio. In her role at Starting Point, BILLIE was instrumental in building the infrastructure of Ohio's early learning quality rating and improvement system, and worked with state and local leaders to establish a statewide scholarship program for early childhood teachers, building a professional development system, launched and implement Cuyahoga County's universal pre-kindergarten program and pre-for-CLE, and created an early learning system for families, helping thousands of programs becoming quality rated. It was no surprise when BILLIE stepped up last year to co-lead the coalition's Lead Safe Childcare Settings Subcommittee, a group charged with charting a path forward to create lead safe spaces in Cleveland. Through her work with the coalition, she convened a table with warmth and professionalism, always asking tough questions and helping the coalition forge a path forward. Under her guidance, the committee commissioned Groundwork to complete Building the Way to a Healthier Future, a first of its kind report that will serve as a powerful advocacy tool to create lead safe spaces in Ohio and across the country. The countless children, families, and future generations to come who've benefited from BILLIE's leadership are all a part of her legacy. And this report and the work to implement the learnings is in honor of BILLIE OSBORNE-FEARS, champion for Ohio children. Thank you.
Thanks, Wyonette, and thank you to the Lead Safe Cleveland Coalition and many of our shared funders who Wyonette listed that allowed for us to engage in this work in a really unique way. We share in the loss of BILLIE OSBORNE-FEARS, and given that tribute, I will read this quote of hers that introduces this report, Building the Way to a Healthier Future. It is unacceptable that in 2020, we continue to have children living and learning in environments where they're exposed to lead paint hazards, undermining their health, education, and foundation for all future lifelong success inside the places that were quite literally built to keep them safe and support their growth. So thank you again for joining us today to explore the intersection between early childhood lead poisoning and child care. We wrote and now release this report in hopes that no matter who you are listening in today, you will find it useful. It is at a foundation and educational resource. So if you don't know much about lead, we invite you to start here. If you've been engaging in this work for some time, we hope you see that as see the report as an additional comprehensive tool that you can reference. And for all of us new or seasoned advocates, we hope it serves as a beginning to a conversation that advances new policy and investments, a path forward for preventing childhood lead poisoning. I have a fairly limited time to share highlights of a very robust report with you today, and we have an excellent panel to dig deeper into those areas I can't cover during the first part of this webinar, so it's important that you know where you can seek additional information in the report. The report provides an introduction to Ohio childhood lead poisoning data, history of national lead policy, and the primary sources of lead poisoning among young children. We then provide an overview of lead policy in Ohio and how it intersects with childcare. We dedicated time to identifying why childcare is such an important partner in lead prevention and provide additional context for why this work is so complex in consideration of Ohio's childcare system and childcare facilities. In addition to providing this information specific to Ohio, we provided a summary of federal funding for lead prevention in childcare, national awareness and education efforts, and a 50-state scan of lead and child care facility policy, where we have then distilled best practices and learnings from across the country to inform work here in Ohio. While it is not the primary source of lead poisoning in Ohio, we did also provide background information on lead and water. The report ends with guiding principles and policy recommendations that create a path forward for prevention work in child care. We hope you will find the appendices helpful. Appendix A is the full 50-state scan where you can reference any regulation that's on the books concerning lead paint and child care for all 50 states. A shorter appendix provides those state policies concerning lead and water relevant to child care as well. So thank you so much. I think when we started this work, we thought that some of this may be out there, and we really hope that this report fills a void both in Ohio and across the nation in terms of a comprehensive approach to childhood lead poisoning and its relationship with the child care system. So Wyonette provided some background on how lead poisoning affects nearly every system in the body and is especially harmful to children in their first 5 years of life because it disrupts that rapid brain development they're undergoing during that critical first few years. And while there's no safe level of lead in the body, public health actions are recommended to be initiated when a child has a blood lead level of 5 micrograms per deciliter of blood. And children living at or below the poverty line who live in older housing are at greater risk. The primary source of lead exposure among children is deteriorated lead paint, so dust. Others include soil, water, and consumer products. Young children are most often exposed when they ingest lead dust by crawling on the floor and putting things in their mouth, playing outdoors or on porches with deteriorated lead paint, or being in or around exposed contaminated soil in a backyard or on a playground. We know that facilities built before 1978 are at high risk of causing lead poisoning in children. This means that 42% of all housing units in Ohio likely contain lead hazards, and that's what this map here in front of you is showing you. Again, there's no safe level of lead in your body. About 3% of 0 to 5-year-olds tested in Ohio had confirmed lead levels of 5 micrograms per deciliter or greater, which triggers that public health response. However, fewer than 40% of our children who were most at risk, so those living in poverty, those covered by Medicaid, were even tested. So the impact is broader than our current system recognizes. And this map that shares the risk of potential lead hazards demonstrates that this isn't just a Cleveland issue or a city issue or an Appalachian issue. It's a statewide problem with devastating impacts that requires a statewide response. Lead poisoning deeply impacts too many of Ohio's youngest children and families and demands our priority. Despite this unequivocal truth, we certainly could not have anticipated releasing this report as we continue to normalize the trauma and crisis to which COVID-19 has conditioned us over the past months. Upon reflection on the impact of COVID-19 on the nation's child care system, the National Association for the Education of the Young Child states, Our nation's early childhood education programs have been navigating structural cracks and financial cliffs for decades. The COVID-19 pandemic has made these cracks and cliffs unavoidable, putting our programs into free fall. If our economy is to recover, it will require a reimagined approach to financing and structuring the systems that support high-quality childcare. If our childcare programs are in free fall, one may ask why this work continues. So why do we ask you to consider how to prevent lead poisoning in childcare programs that weren't financially sustainable prior to the pandemic, and for which there are seemingly little to no new state resources that could support a policy change? How do we share this rich body of policy research on lead and childcare amid a global pandemic and civil unrest in our communities? As early childhood advocates, we are certainly not strangers to the real and acute barriers to progress, but our response is simple. How can we not? Lead poisoning is a public health crisis. Even before the global pandemic of COVID-19 devastated our state nation, lead poisoning was having a devastating impact on young children and families in Ohio. Lead poisoning is also an equity issue. Much like COVID-19 is disproportionately killing Black Ohioans, it's no surprise that Black families are also more exposed to environmental dangers such as lead hazards than their white peers. Black children living below the poverty line are twice as likely to have elevated levels of lead in their blood than poor white or Hispanic children. The disproportionality is related to the physical and social conditions experienced by Black children and families as a result of structural racism and a history of policy and practices that supported segregation and isolation from opportunity for low-income communities and communities of color known as redlining. Wyonette mentioned a study from Western Reserve University that recently published findings from a longitudinal study looking at children over time, and again found that Black children were the most impacted because of they were the most likely to be experiencing these elevated rates of lead in their blood. And the study found that, for us, this is no surprise that children with elevated lead levels in early childhood have significantly worse outcomes on markers of school success, higher rates of adverse events in adolescence and early adulthood compared to their non-exposed peers, and they represent a sizable societal cost due to the loss of human capital, the burden on local systems, and persistence of inequality. There is no proactive requirement for lead testing of schools or childcare facilities in the state of Ohio. The investigation into the facilities or the cause of lead poisoning arises out of lead screening and testing performed primarily by pediatric primary care doctors. Ohio law relies on the finding of a young child having been lead poisoned for an investigation to be initiated. When a state or local Department of Health becomes aware that a child under age 6 has lead poisoning, they are charged with determining the source of the poisoning. And in conducting that investigation, it can include the child's home, the child care facility, or school where there's a reasonable suspicion that one of those places is the source. In Ohio, we have child care programs that operate in commercial facilities, so center-based programs, and in residential housing, in family child care homes. The slide you see in front of you is a summary of regulations that apply to licensed child care centers and family child care homes in Ohio. These regulations require that equipment will be free of lead paint and the environment will be free of lead hazards. Current law and guidance reflects that Ohio has included signals in their child care licensing regulations and guidance, but in practice, the licensing inspection is limited to a visual inspection and based upon the training of the licensing specialists who are neither trained or certified to make these determinations, unlike a lead risk assessor. Additionally, the child care licensing application asks if there are no lead hazards, which wrongly assumes that child care programs are both informed on lead hazards and have sufficient resources to make that determination. Further, there are no additional resources to support removal of lead hazards in child care. Child care is a critical partner in lead prevention, and closing that disconnect between what's on the books and what happens in practice in terms of lead policy in child care. Those early education professionals are one of the state's most critical assets as we seek to promote high-quality early learning and close gaps among children based on race, geography, and socioeconomic status in the first 5 years of life. And there's no doubt that child care providers and early childhood stakeholders across the state want to ensure that children are living and learning in safe environments. And as the political will in Ohio has increased to combat lead in places where young children live and learn, there's a legitimate concern and lack of understanding of how any additional regulation or policy change could impact the child care system. First, we have to recognize that child care policy has never had a robust facility component, particularly in the state of Ohio. As we consider the child care crisis prior to the pandemic, and now as the system is on the verge of collapse, the needs of an underpaid and undervalued professional child care workforce, our commitment to increasing quality care, and the reality of being on the front lines of the COVID-19 pandemic, we have to be really thoughtful about how we move forward And regardless of what the choices are moving forward, childcare has to be at the table as a partner. Equity, cost, functionality, and sustainability are among the myriad of factors we have to consider when we make choices about investing public dollars into early childhood facilities. In the report, we've created a list of questions to consider in applying these factors as we think through potential policy and investments. In our national scan of the report, we provide a summary of federal funding streams and efforts, but I really want to highlight the 50-state scan of childcare and lead policy. When we take a look at what's happening across the nation, overall, the regulation of lead hazards in childcare facilities appears somewhat weak. What's less clear, however, is the state's effectiveness in reducing childhood lead poisoning as a result of those limited regulations. In other words, is there a size for the scope of the problem in the state? Most states don't specifically address lead in their regulations and rather choose to address it among a blanket requirement that the childcare facility shouldn't contain hazardous materials. Only 9 states require an inspection by a lead risk assessor prior to a childcare program becoming licensed, and most states only have regulations that are applied after a visual inspection of the facility where paint is peeling or chipping. Even where lead is identified as a hazard in a facility, many states don't lay out then a requisite response. So given the continuum of policy choices and diversity of outcomes of these policy choices in the 50 states, Ohio has a real opportunity to learn and emerge as a leader in ensuring that children are not poisoned by lead in childcare facilities. Based upon a review of these state regulations, we identified and elevated 16 best practices to be considered when making policy change in Ohio, and I want to highlight a few of them now. So first, regulations are an important indicator, but they're not the only indicator. So really, the implementation and the enforcement and the education that occurs along with regulations are determining whether or not there's an impact on outcomes. Are you actually decreasing childhood lead poisoning in your state? The second is, and this will be a common theme among my comments, and I'm sure the panel's comments today, is that regulations of any policy must be adequately resourced. We know that where there have been very well-intentioned policy changes in states, they can have really terrible unintended consequences on the childcare sector. So, for example, with a really strong regulation that requires a lead-safe assessment before the childcare is to be opened, you can really push a lot of providers into unregulated care. And that really impacts deeply access to high quality childcare that we know our children and families need. The third is regulation and our policy change has to be accompanied by strong public and stakeholder education and training. So where we saw success in other states, regardless of what the regulation was on the books, was where they had brought in these partners, especially childcare and other early childhood stakeholders who at their core are called to respond to the needs of children and their health. And so we're natural partners in this work when provided with information resources they needed. Next, in this kind of common theme, is that non-regulatory approaches can be equally as impactful. So again, putting the resources and the relationships behind the intention of these policies, the regulation in itself was not sufficient and not even necessary to get the impact that one would desire in terms of outcomes. The last couple here are that all approaches have to be measured. So, again, it wasn't clear, despite what we learned about what type of regulations were on the books in many states. It wasn't clear how that was being measured and evaluated, both in its implementation and enforcement stage over time, as different, policy focused or political will or the political landscape has changed over time, since there may have been focus on it, 20 years ago or a decade ago. And the last that I'll mention again is that childcare and families really have to be centered in this work. They have to be at the tables where policies are being made. They have to have opportunities within those regulatory choices to lead and meet partners in co-creating solutions for change. So how can we build a better way to healthier future? I first encourage you to review the guiding principles that are in the report. Many we've touched upon certainly throughout this presentation, but use them as a framework for continuing this conversation. So view this this report again as a tool to continue conversation and use these guiding principles as some guideposts for the conversation. We put forth 9 policy recommendations to consider in advance, and I'll go through those with you here now. The first is to commit fully to the primary prevention of lead poisoning in childcare settings. So we have to stop settling for our current reactive approach to lead poisoning. Our children and families deserve more from our systems, and more from our systems than to only take action when there's already irreversible harm done to children and families. Our second recommendation is that we really need to zoom in and determine the scope of the problem of lead hazards in childcare programs. So unlike that heat map I showed you in the beginning, we really don't have that same type of tool for us when it comes to either family childcare programs that are in residential units or center-based childcare programs that are in commercial buildings. We really need to take a deeper dive and look closer to that statewide and local data so we can target responses and understand the scope, and so we can match the policies to what the scope of the problem is. Third, we have to build upon trusted relationships with childcare professionals, educate them about the impact of lead exposure and lead poisoning prevention practices. There is just really even most stringent regulatory approach to reducing lead poisoning among young children. I know Groundwork, even among the staff, for us, I mean, we have learned so much in the writing of this report that there's a real opportunity to share and communicate and build partners across the state in the childcare field and the broader early childhood field in this work. So we provide creative next steps to engage in that type of education. Our fourth recommendation is to improve, promote, enforce, and resource regulations and implement non-regulatory initiatives to decrease childhood lead poisoning in childcare settings based on best practices. So those best practices I went through earlier, we think that they need to be evaluated in the context of Ohio. And again, finding where the barriers are, or finding where the misconnections are to really strengthen the policy that we do have and that we should be proud that we do have in the state of Ohio in terms of the requirement that our child care programs need to be lead-free. Okay, the fifth recommendation is to resource existing and new regulatory and non-regulatory initiatives to support lead-safe spaces for young children to learn. So we have to advocate for increased or new investments with state funds, with federal funds, and take a look at private-public, unique private-public partnerships and funding mechanisms to really bring resources to policies that we know work. The sixth recommendation is that we need to explore strategic funding options through Medicaid to eliminate lead hazards in child care facilities for Medicaid beneficiaries. You know, low-income children are covered by Medicaid, and we really have to engage Medicaid managed care plans who are serving those same children who are most at risk, and also look to increase funding to allow expansion of lead remediation programs currently funded by Medicaid dollars. The next policy recommendation is to engage child care programs and secondary lead poisoning prevention alongside any primary prevention initiatives. So child care neighborhoods, this is about facilities, but this is also about meeting the needs of kids in their classrooms who may enter their program lead poison, making connections to early prevention, to evidence-based home visiting, parent education, understanding what professionals can do in the classroom to support lead poison children, support testing and screening and preventative health care. Childcare is really a conduit between children and families and the entire early childhood community, or the entire community of providers and stakeholders that our system has set up to serve their needs. The next policy recommendation is to develop and implement a state-level communications and advocacy campaign to elevate and implement a consensus policy agenda for change in lead-safe childcare policy in the state. So for our audience members who have been with us for a while, Groundwork Ohio, we need advocates behind us. We need you, we need your voice, and we need a coordinated effort to build out these policies and a really robust system to respond to these needs. Lastly, again, I will stress again that we have to include child care professionals, parents, and families of young children personally and health and well-being of them and their children. All of our work at Groundwork is deeply personal to the lives of children, families, and the professionals who serve them. And so our policy development and advocacy must reflect that, especially when we're looking at childhood-led poisoning. So today we have an incredible panel of state leaders to discuss our findings and their reflection on the report and their work more deeply with us. We are lucky to be joined by Gabriella Celeste. She is one of the co-chairs for the Ohio Lead Free Kids Coalition and comes from the Schubert Center for Child Care Studies. Amy Cole, who's the president of Molina Healthcare. We have Director LeeAnne Cornyn from the Governor's Office of Children's Initiatives, and Katie Kelly, the Executive Director of Free for CLE. So as we get started with our panel discussion, I'm going to ask each panelist to answer the same question first. They'll have a few minutes to do so in an opening statement where we'd love for you to share who you are, what your commitment to Lead Safe Kids in Ohio has been, and how you view child care's role in this work. So I'm going to go ahead and ask Gabriella to kick off this conversation.
Thanks, Lynanne. Can you all hear me? Great.
Yes.
Thank you so much, and thank you to your incredible team for this phenomenal resource for our state. It really, I think, elevates the work that's being done in Ohio, and I just can't commend you enough. I want to just say briefly that as a policy director at the Schubert Center for Child Studies at CASE, we really seek to bridge good research and education with good policy. And so it was a natural fit for me to step in and help chair the Ohio Lead Free Kids Coalition, which really came about with the new governor and his team, and an opportunity to weigh in on what kind of investments we could make in the last budget. You know, our coalition is a collection of organizations, individuals, and parents who really share a deep and urgent concern about the potentially lifelong harm caused by lead poisoning and, you know, the future well-being of our state. So we've really worked to try and put forward a clear vision for what a comprehensive approach to primary prevention might look like. I'll shamelessly plug our action plan for lead-free children, and it's on our website, and we hope folks will take a look at it because it includes sort of 9 points that include what we're talking about today, and Groundwork. We're thankful you're a part of that coalition, having informed that work. So we see our role as really trying to help support our public leaders and policymakers in setting the course for continuing to build on the investments that we have. And I want to also just say that we are, in terms of the child provider's role, you know, as you've pointed out, you know, other than I think nurses, maybe pediatricians, our childcare providers have the most really trusted relationship with parents, and it's that special and unique relationship that really makes you all especially well suited to carry these messages in a way that parents will hear. And so we really value the really precious space that the early childhood community occupies, and we think then that it's important for us to figure out how to work hand in hand to support really a truly primary prevention approach. I'll stop there because I know I get a chance to say more, but thanks.
Thanks, Gabriella. Katie?
Thanks so much, and thanks everyone for being here today. I'm Katie Kelly. I'm the director of Pre4CLE in Cleveland, which is an initiative in Cleveland looking to expand high-quality preschool to all 3- and 4-year-olds within the city. And in that role, we spend a lot of time thinking about the quality of our programs, and also over the past several years have spent a lot of time thinking about the quality of the facilities that our programs are in as well. And so we're very happy to be a part of this work. We also, I think more importantly for today, sit on the subcommittee, the Child Care Lead Safety Subcommittee of Lead Safe Cleveland. And so I'm here to bring some of that perspective of the work of the committee that helped to commission this report and is looking comprehensively at those issues, not only in Cleveland, but hopefully, as Lynanne said, to be helping to start a conversation across the state. And so today is a really important part of that, and we're really happy to be here. So thanks so much.
Thanks, Katie. Amy?
Good morning. I am Amy Cole. I'm the Plain President of Molina Healthcare of Ohio, and just so pleased to be part of this very important conversation today. For those of you that may not be familiar, Molina is a managed healthcare plan, and we are dedicated to exclusively serving government programs. So here in Ohio, we are proud to serve over 350,000 members, and of those, 135,000 are children between the ages of 0 and 18. So for that reason, we have placed lead testing, education, and prevention as a priority health equity issue, where we work to design interventions in an effort to support our families to stay healthy and thrive. So in regards to our commitment, right, we're a statewide Medicaid managed care plan. And as we partnered with families, providers, community organizations, many of you, I'm sure, on the line, to design programs to really ensure appropriate access for lead testing and to educate families on lead poisoning risks and prevention, we really quickly identified the importance of child care centers and the social network for the families that we serve. I mean, these child care centers become a second home for children. And for this reason, we really decided that it was important that we made that a part of our strategy to promote lead safe spaces and reduce lead hazards. So just want to thank you all for the great work you do in this space and the discussion today and the groundbreaking report. Thank you.
Thanks, Amy. And Director Cornyn.
Good morning, everyone. So as the Director of Children's Initiatives for Governor Mike DeWine, I help lead many of our cross-agency initiatives, including Ohio's response to lead poisoning and lead poisoning prevention among children. In that capacity, I serve as the chair of Governor DeWine's Lead Advisory Committee. It's a multidisciplinary committee of subject matter experts from across construction trades, public health, medicine, local and state government, economic development, and many, many more. And certainly that includes representatives from the Ohio Department of Education, as well as the state and local Department of Job and Family Services, who serve and support our many child care providers across the state. We are in the process of developing recommendations. The governor convened this committee in the fall of 2019, and we are working on wrapping up our recommendations, which we hope to have finalized by the end of this year. Right now, while they're still tentative and subject to change, we anticipate that the recommendations will really span 4 different domains. One is education and outreach, so focusing on public awareness, how we're educating not only homeowners, renters, moms and dads about the importance of lead testing and making sure that they're living in lead safe housing, but also the professionals who come into contact with their kids on a day-to-day basis, whether that's medical professionals. Certainly childcare providers are an important part of that. So currently the recommendations as written include expanded professional development opportunities for providers and staff, really understanding what are the signs of lead poisoning and what are the next steps to take with families and with the supports in place to make sure that kids are accessing critical services. Data and collection. We need to make sure that our data is more widely available across state and local entities to make sure that we're serving and supporting kids, but also ensuring that we're taking data-driven decisions to support our most at-risk communities in our response. Focusing on lead hazard control. We have done a really great job of expanding eligibility and making it easier for families to access many of the resources available at the state level, especially through SCHIP. In our most recent budget, we were able to eliminate the match requirement that many families faced, which created a sort of an artificial barrier for families who had children who were lead positive to be able to abate their home of lead hazards. So we also were able to expand eligibility for the properties that could be abated. So it not just is the child's primary residence, but maybe if grandma and grandpa or a child care provider cares for that child during the day, they certainly could be eligible to have their facility abated if that's where the point of contamination occurred. But there's still so much more to do in that space, especially when it comes to giving the Ohio Department of Health the tools it needs to appropriately regulate our contractors and ensure adequate access to additional lead abatement programs. And then finally, workforce development, making sure that we have an adequate workforce who are able to serve families, and especially targeting some of those workforce development opportunities within impacted communities. So again, we hope to have these recommendations finalized by the end of the year, but clearly our childcare professionals are critical in not only identifying our children who may have delays associated with elevated blood lead levels, but also now that we're on Step Up to Quality, as we move toward higher levels of quality, it's all about how our providers are engaging in educating parents as well. So again, all of those recommendations build off some of the great work that we've already been able to accomplish in the state, which I'll get to in the next question. But thank you all, and thanks Lynanne for the opportunity.
Thanks, Director Cornyn, and for your leadership at the state level. I'm just so pleased that you all can join this conversation today, because whether it's from your local lens or your statewide lens, in learning, child health, all of our work is shared, because we're literally talking about the same children and families, and trying to find really a better way to serve them and meet their needs. And thank you also, Amy, for being here. You know, I think that there's a lot of opportunity to work with our health plans and our health partners. So as you know, early learning focused community, and those of you in the audience, we have to build these relationships both locally and statewide to leverage policy for our youngest kids. So now I'm going to move to the part of the panel where each of you will have a more directed question to each of you, and I'm going to start with you, Katie. As we kind of look to translate your role and your work into more action here in Ohio, I'd really like, Katie, for you to share more about the unique complexity of the child care system when we consider strengthening implementation of policies or the introduction of new policies, and how we may work together with the child care field to advance children's health.
Sure. So thanks, Lynanne. And I just want to build on your comments as you went over the summary of the report. I think there's so much great information and reflections in here about some of the complexity of the system and what we need to do to work through the system to really advance these goals around lead safety. And so I think you really hit on a couple of the really important parts, which is, you know, right now there are sort of limited visual inspections going on when a child care center is licensed, but there is not the right level of sort of structure and support and funding to follow up what may be identified by that initial visual inspection. And importantly, I think we need to think about the kind of deeper assessment that needs to happen and be made available to programs in order to ensure that those sites are lead safe. And so those are the kinds of things that I think we really need to think about. How do we implement that statewide? And I think some of the great work that's already going on at the state level is illuminating a lot of that already, and the need to really understand the scope of the problem is a big part of that. So I think we are definitely headed in the right direction, and some of the interim steps that have been put in place to connect programs with health departments is a really important first step. But understanding what health departments then need to help those programs is a part of that as well. So, you know, that's sort of the initial of what's happening now. And then also when we think about the tremendous accomplishment of all of our publicly funded childcare programs now being in Step Up to Quality, you know, what can we leverage through Step Up? And I think some great ideas were already shared around helping programs who have that great relationship with families educate them, but also I think making sure that the quality of our programs also is reflected in the quality of the facilities that they're in. And I think, you know, this is an area where we have a lot of room to grow and to advance these goals, and making sure that, you know, the safety and the quality of the facility matches the wonderful quality of the programming that is going on inside childcare centers. And I think to that end, you know, one thing that I wanted to talk about and point out to all the folks who are listening into this call is really on page 20 and 21 of the report, you went over briefly those 5 elements that are important to think about in this context. And I think that those are really critical. So I would really encourage people to go over those closely. And we are doing some work in facilities in our community and seeing these exact elements be so critical around equity, you know, making sure that all facilities serving young children have the same safety as a baseline, safety, warm, safe, and dry, but then also have things like natural light and fresh air and indoor and outdoor space to play, and just the configuration of a space to really make sure that it's conducive to early learning. So I think we need to think about both of those things as we enter this space. And I do think that relates to lead, because as we're looking at lead, taking a broader look at the facilities and how they support early learning is really critical. And then of course, we've all talked about a cost so far, but thinking about what is the cost to do this kind of work? And that really is going to be individual to each site in each building, and whether or not a site is renting that space or own it. All of those things have to be part of that consideration to understand the cost, the viability of undertaking any sort of lead safety remediation or renovation, and then also, is that sustainable for that particular site? So I think, you know, as we get into this space and think more about the system, we need to really think about it in a very multifaceted way. Think about how it impacts the programs and their viability. Think about how it impacts children and families, and really take a very ambitious but thoughtful approach to how we enter into working together to make the system stronger. And I would just echo what you said about the importance of providers and families being at that table as we craft those solutions. They are really the ones who are doing this work every day, who are in those facilities, who understand the importance of facilities' role in early learning. And so looking to their expertise and their real world experience for guidance is going to be so critical. So we are very excited to be a partner in this work. And I think, you know, it is just, I think, a great moment in our state where we have a governor who really understands the importance of lead safety in a proactive approach. And I think partners across the state who are very ready to begin this work and really look at what we need to do within childcare facilities.
Thank you so much, and thanks for bringing more attention and your really local expertise as you're really close to the programs and have been deeper into this facility work. We noticed, at the national level, it is reflective of what we're experiencing in Ohio, is that facilities have really taken a back burner. And as we investigate this kind of fragility of our system, both before and during COVID, that it really requires this holistic response where lead safety may be the driver of it, but the thinking and the outcomes are so much broader even than removing lead hazards themselves. So thanks so much, Katie. Amy, I know Molina has a deep commitment to the health of young children, and you're doing some really exciting, innovative work, especially with community-based partners. I'm wondering if you can share a little bit more about Molina's commitment to lead-free kids, and specifically in childcare settings, the work that you are doing in the Appalachian region.
Yes, thanks so much, LeeAnne. So at Molina, our clinical teams, including community connectors and housing specialists that are working in the community, are really committed to early detection of lead levels in children through partnering with physicians and community organizations to improve the rate of lead testing for our kids. So historically, that's been our approach, working out in the community with our partners. But through this work, we track to risk factors such as children who live in a home or regularly attend a child care center that was built before 1978, as we all know. And understanding, of course, Molina has put this as a high priority health equity issue. And we've been evaluating ways that we can make a greater impact to preventing lead poisoning and increasing lead safe spaces. And we were quickly introduced to the Corporation of Ohio Appalachian Development, which is a remarkable organization. They have been serving the 30 counties in southeastern Ohio for more than 40 years through various programs, one being their early care and education division. And this division actively works with 274 licensed childcare providers in that region. So through our Molina's Social Determinants of Health Innovation Center, we were really honored to be able to provide them with a 2020 Molina Community Innovation Fund grant that allowed them to expand their lead screening of child care centers in that region. And it also covers the cost of abatement when that's needed to then certify those facilities as lead-free. So really remarkable work underway right now. It's an active project, and we're tracking to the contacts that they're making with those child care centers and the activity happening, and really excited to share more about the results of the program in the coming months. And just want to thank you, LeeAnne, for the opportunity to highlight the program and the great work that team is doing.
Thanks so much, Amy. And I wonder if I could ask a quick follow-up, which would be that, you know, a lot of our audience may be early learning professionals and others. Can you just share a little bit about how you would invite them to work with Molina or another healthcare plan when you're looking at, you know, those are the same kids you're serving in that child care program, for example, and who you all serve? What would kind of be your invitation or call to those local folks who are wanting to connect more?
Thank you for that opportunity. So the easiest way to get in contact with Molina is we have community engagement specialists that are out in the region, and they are, you know, our key connectors to all of our community partners. So you know, getting in contact with one of those individuals, and their information is on our website. So you can find that. And of course, you can always email me and I will get you directed to the right person. But through our Innovation Center and some of the work we're doing there, we just have the ability to test and pilot different programs. And this partnership is with the Corporation for the Appalachian Development Team is a great example of that. And then there's, of course, things that we're doing day to day as well. So a lot of opportunity to partner, and that's really how we're able to be successful. I think that's one of our challenges, is there are so many opportunities to work with our Ohio families, but we want to not duplicate one another. We want to make sure we're being smart with the resources that we have and helping one another stay connected and taking lead where that makes sense. So really welcome your engagement and working with us on this issue. So thanks for that, LeeAnne.
Thanks, Amy. Gabriella, what are the foundational policies and investments in our state that are necessary to create lead-free environments for kids both to live and learn?
Thanks, LeeAnne. Well, certainly our Ohio Department of Health Childhood Lead Poisoning Prevention Program provides essential, public health lead investigations and education and data, including the Lead Safe rental registry, by the way. But, as we've talked about, our approach really relies primarily on children as lead detectors to initiate action, which is why we really see the need for investment in primary prevention as critical. I really want to commend the Department of Medicaid, Ohio Department of Medicaid and Department of Health under the governor's leadership for the SCHIP lead abatement program you heard LeeAnne mention earlier. It's really our premier prevention program for children, providing funding to abate lead in homes that were built pre-1978, which is where Medicaid eligible children either live or spend at least 6 hours a day. So of course that could include daycare centers. And in Ohio, this is so important because over 2/3 of our housing stock was built before 1978, and nearly 500,000 children live in these homes. So we really need to not only sustain, but really strengthen and build out this program. It's an incredibly cost-effective and critical program. But the second sort of foundational policy I really want to lift up is complying with a federal law that's been around now for over a decade, the Renovation Repair Paint Rule, or RRP. And it's critical because we really need daycare administrators and providers, as well as parents, to understand how kids can be, inadvertently exposed and harmed during, renovation and repair in these facilities, and how to take active steps to use lead-safe work practices to really protect children. There's actually I saw in the chat someone asking for a resource. US EPA has a very small and doable, kind of readable booklet for daycare providers on the RRP rules. So we'd encourage you, maybe we can throw that in the chat box. And the last thing I just want to say is I think it's important, you know, ODJFS does have some licensing rules around safe equipment and safe environment in the play area of daycare, childcare facilities. And we should really help provide more explicit just guidance about what that could look like. I think we really have to move from, you know, sort of a don't ask, don't tell approach to a more proactive, how do we really protect kids from lead hazards using the lead safe approach.
Thanks so much, Gabriella. And we're going to round out our conversation with you, Director Cornyn. We know the governor's prioritized and specifically named childhood lead poisoning as something that must be addressed, especially when we consider it as an equity issue with Black children and families disproportionately bearing the brunt of its impact. Can you share some work that you're proud of and work you may anticipate as you and the governor continue to this issue in statewide policy? And of course, we'd love for you to share how advocates may support your work.
Sure. So I am obviously beyond honored to work for a governor who has elevated the priority and profile of childhood lead poisoning. It really is, you know, something that probably wasn't necessarily adequately addressed historically. So we're excited and proud to do this work. Second, there's a lot of work that's already going on that I think has been immensely successful. In our previous budget, I mentioned, and Gabriella sort of highlighted some of the changes that we made to our state CHIP program to make it more accessible for children who have elevated blood lead levels for their families to access abatement services. In addition to that, we are supporting homeowners, you know, low and middle income homeowners who want to abate their own homes with a property tax credit for the cost of those lead abatement services. That's available starting this fiscal year when individuals filed their taxes in 2021. We've also made the existence of an elevated blood lead level of 5 micrograms or higher, a categorical eligibility for early intervention services. And these are critical support services that help, you know, kiddos be successful academically and socially, you know, by providing those upfront interventions, potentially even before a delay occurs. So through that expanded eligibility, we've provided a 5-county region with support services for nutrition for these children. We know that nutrition is critical to sort of eliminating the lead toxins in kids' bodies. We've also expanded and served about 60 new kids, many of those from the greater Cleveland area. And we've also provided some additional funding for training and professional development. We know that sometimes these young kids may have some social and emotional challenges that they experience in addition to academic delays. So we have also invested heavily in our early childhood mental health consultation program for children who have specialized service plans because they have a documented delay. So it's a great opportunity for us to meet their social and emotional needs as well. We've also been able to invest pretty heavily in supporting lead abatement in childcare providers through our H2 Ohio Fund. So through a $725,000 grant to the city of Cincinnati, they are now able to remove lead service lines and lead fixtures in childcare centers, about 185 childcare centers across the state. So there's so much work going on. There's so much to be proud of. There's so many sort of early wins. Certainly there's plenty more to do, but the governor has made it clear that this is part of his strategic priority to advance equity, and this was one of the key elements that was included in Ohio's executive response. So certainly it's our goal to continue supporting these programs and ensure a long-term strategic response to lead poisoning and elevated blood lead levels, especially among, you know, extremely vulnerable populations.
Thanks, LeeAnne, and thank you to you and Governor DeWine. You know, our report today was pretty focused on the child care system, but I hope you saw in our recommendations that this really, you know, that what you've laid out is really reflecting just first how complicated this system is, but what the power of a really holistic early childhood focused responses in terms of leaning into childcare, early intervention, evidence-based home visiting, and then those foundational policies through Medicaid and those stakeholders that I'm not familiar with, but in terms of the housing stakeholders as part of this conversation. So thank you so much for your work and your dedication to the childcare system, both during this pandemic and before. We look forward to leaning into those things that are aligned in our policy recommendations and building up all of our external stakeholders to help support and make progress to ensure that no child is lead poisoned in our state, and certainly within our child care facilities, that should really be a fundamentally safe place for them to grow and thrive. So thank you very much to all the panelists today. Again, if you have any other questions, we'll follow up from the chat box. Please continue to use support. It's available at readysetsorg.org, and we'll put that in the chat box. Thank you. Have a fantastic rest of your day, and feel free to lean on us or the panelists as you continue to work in your communities. Bye-bye.